Hi, I'm Dr. Leong Hoe Nam from the Rophi Clinic. Myself, as well as Dr. Ling Li Min, we are infectious diseases physicians and we want to just make science simpler and relevant for everyone. We're doing this YouTube channel. We're going to talk a little bit about Pfizer BioNTech's latest announcement. They were saying that their Pfizer vaccines, 3 doses is adequate to overcome the Omicron virus. We're going to delve deep into the data. Bear with me. I'm going to show you the data and together we can see why they say so. First slide, we actually show you the Pfizer BioNTech reports. You can see the press conference. There's a QR code. Scan it. View the presentation yourself. You can even download the presentation and read it yourself. Before I delve into the immunity of it, look at this slide which shows the Omicron showing the multiple mutations with other SARS-CoV-2 variants. We know the variants are Alpha, Beta, Gamma, Delta, and of course Omicron. That's shown on your left, right at the bottom. And between that and Omicron, we actually share similar mutations. You see it coming in blue, that's the Alpha. We have the Delta coming in yellow, share 2 similar mutations, and of course Beta sharing 1 similar mutation. But that's not the end of the story. Omicron looks like the ominous virus that will rule them all. Look at the number of mutations there are for the Omicron virus. It is adapted. It looks as if it has gone for makeover. With makeover, which means you fail to recognize it, just like you fail to recognize a friend who had a makeover. If you look at the whole viral genome, the whole genetic structure of it, there are about more than 50 mutations in the viral genome. So if you look at the spike protein is how the protein interacts with the human cell. There are at least 30 spike proteins. So all in all, it is a massive makeover. And of course, the virus has spent a lot of effort to try for this makeover in terms of losing a lot of mutants. Not easy, but it is really a significant change. What's the significance of it all? It wants to evade existing immunity. In fact, it wants to infect people again and again and again. That's what I would do with a virus. I want to terrorize humans again and again. Why? So that I can ensure the survival of my progeny and the virus will go on to live on and on and on. Now, this is the slide which actually shows you that the Pfizer BioNTech vaccine can neutralize Omicron. How did they do it? Let's look at the slides. On the y-axis, you have your neutralizing antibodies. The higher it is, the better it is. Then we see an orange line that's drawn across. That's the level at which you need to try to overcome Omicron. That's the barest minimum. You can call it the passing mark. At the bottom x-axis, you would have the different viruses. You have the ancestral Wuhan virus coming in green. You have Omicron coming in purple. You have the red coming in beta. And of course, Delta coming out in blue. So with all these different viruses, which one makes the grade? Let's look at the columns on your left. Pfizer BioNTech, 2 doses 21 days later. For the Wuhan ancestral virus, it makes a grade. There's enough antibodies to neutralize it. For the beta, it makes a grade 2, you pass it. But for the Omicron, it's below the line. When it's below the line, it means you can be infected again with a virus. And which means the Pfizer BioNTech isn't that effective against it with 2 doses. So what if we actually go for the 3 doses? 1 month after 3 doses, let's look at the antibody levels again. You have the ancestral Wuhan virus, it makes a grade. You have the Omicron virus that makes a grade. You have the Beta virus that makes a grade. And eventually the Delta. In other words, if you have 3 doses of the Pfizer BioNTech vaccine 1 month after the 3rd dose, you have enough antibodies. Now, I would take the cutoff at 2 months. 2 months after the 3rd dose, I have enough antibodies to protect. So that's antibodies, and as you realize, if you've been following my programs, that represents the B cell immunity of it. It measures the amount of antibodies the body can make against the virus. And in the earlier slide, we showed you that when you have 3 shots restores the immunity that's needed. That's very good. What about if you look at the T-cell immunity? The T-cell immunity, you have your CD4, CD8 cells, you have your cytotoxic T-cells, helper cells as memory cells. What about it? Well, it is there too. We didn't measure. Pfizer BioNTech didn't measure that. They only looked at the B-cell immunity. And if we just look at the B-cell immunity, just B-cell immunity alone, we are too myopic because there is the T-cell immunity that helps very much. B-cell is important because it's the first line of defense. If the virus comes on, I need my antibodies to push it away and block it away. It is very much affected by mutation. And mutates, it fails to bind, in turn, it evades the immune system. And it is the makeover which the antibody doesn't recognize. Very importantly, the B-cell immunity determines if the infection occurs. If you have good B-cell antibodies, high amount of which, infection does not occur. So that's the B-cell immunity part of it. But if you look at the T-cell immunity, you have the second line of defense. If it breaks through the B-cell, you still have the T-cell that will block off the virus. That's very important. And it's important because it's less affected by mutations. Mutations will change the spike proteins, but the T-cell immunity is still able to block it off even if there is significant makeover to it. And in turn, T-cell determines the severity of illness. If you end up with severe illness, it's because your T-cells are not too good. If you end up with mild illness, that's because your T-cells are able to cope with it. Now, that's data coming from Pfizer BioNTech, and it's very much laboratory or what we call in vitro, very much in the test tubes. What about the real world data? This is excellent work coming out from UK. The first author was Nick Andrews, and it is from the UK Health Security Agency, where they looked at COVID-19 vaccines in relation to the Omicron virus. How does it work? They use a method called a test negative case control design. I'm not going to touch about it, but it is the way forward to look at vaccine efficacy and effectiveness. You look at the vaccine effectiveness against symptomatic disease after 2 doses of AstraZeneca vaccines or 2 doses of Pfizer COVID vaccine. And we'll look at the booster effect as well. This is real world data, and this is the best there is. Now I'm going to show you a rather complicated slide with this real world data. It looks at AstraZeneca with Pfizer as a booster as well as Pfizer with a Pfizer booster. Before I explain the graph, let's look at the baselines. On the red arrows, it means 0 vaccine effectiveness. Anything that's green, it tells you the vaccine is effective. Going upwards on the y-axis, if it's going downwards on the y-axis, it means that the vaccine is not effective. In the first 25 weeks, we highlighted in yellow. With time, AstraZeneca vaccine effectiveness falls. If you look at Omicron, it is consistently below 0. It tells you that the vaccine doesn't work. It's poor for the Omicron with just 2 doses of AstraZeneca. But what happens if you give them a booster? Booster highlighted in green now, you see the levels go up. The booster vaccines kind of helps the effectiveness of the vaccine recover. Now let's look at the right side of the graph. Again, the yellow is for the Pfizer vaccine effectiveness that falls with Delta with time. You do see Omicron effectiveness as well. There's some effectiveness, not tremendous. You're talking about 30 to 40%, but with time it falls further. Looking at the green bars now, you actually have the booster vaccine come in. 2 Pfizers plus 1 booster. Again, you have the recovery of the immune function, recovery booster. So real world data tells you that even though you had 2 AstraZenecas that weren't very good, you have a booster shot, you are great. If you have 3 Pfizer vaccines, you do have vaccine effectiveness. It restores the health of your vaccine status from non-effective to effective. We saw that in Delta previously, and we're seeing it again with COVID. Real world data, summary point, showing 3 booster doses of Pfizer works well for the Omicron. What's the significance of all this? I think the mRNA vaccines work. 3 doses is the de facto. It is the way to complete vaccinations. In fact, I believe that Moderna should have a similar response. We have yet to hear from the Moderna company. This is a shout. Can you give us the data? Because we want to see the data and we want to see real life data, just as what UK has done with the Pfizer BioNTech vaccine. Besides the B cells, the T cells are also effective. Remember, the T cells are less affected by mutations. This may explain the relatively milder illness we observe in Omicron so far. Perhaps previous infections, perhaps previous vaccinations have rendered the T cells more potent so that it can actually block off the Omicron virus. This may explain why we're seeing milder cases coming from South Africa. That's the end of my slide. That's the end of this YouTube. Please, if you enjoy it, let us know. Do subscribe to the channel. We will try to update this channel as often as possible and to just deal with things regarding Omicron or other infectious diseases, COVID or non-COVID. Post your questions, give us ideas on what we can talk about next by leaving your comments at the comment section. So until the next video, see you. Bye.